and those regulations aren't going to go back to where they were. Telehealth is going to be a digital tool that healthcare systems can use to provide care on an ongoing basis, which is great.
Hi there, and welcome to the Kiwi Leadership Network's new series called Kiwis and COVID. My name's Skye Duncan, and I'm one of the board members of the Kiwi Leadership Network. We're a 501c3 nonprofit organisation based in the United States. We have a mission to look at how we can help inspire, assist and support Kiwis in the US. So as you all know, at this moment, we're facing an unprecedented global crisis with the COVID-19 pandemic. And we at the Kiwi Leadership Network thought this would be a really important time to connect Kiwis who are facing this crisis in the United States, which you'll know has been particularly hard hit by the virus. So we're launching a mini-series of interviews with some of our humble healthcare heroes in the United States. And one of those healthcare heroes leading the way with digital healthcare is Paul Viskovich. So Paul is the founder and CEO of a company called Healthfully, which previously known as Optima Curis. And Paul's based in LA, and he's had over 20 years of experience in the healthcare software industry. He's deployed healthcare technology in over a dozen countries with a very strong global perspective. And his company takes on the mammoth task of simplifying the healthcare experience for patients and providers and families. And it's such an important resource. And we all know, as we know, it can get very overwhelming staying on top of all the healthcare work. So thanks, Paul, for taking the time to chat with us today and to talk about some of your experiences getting to the States, but also facing the current crisis through your work. I'd love it if you could start by just telling us a bit, and the listeners, a little bit about yourself and about your company, Healthfully.
Sure. Thanks, Skye, and thanks for the opportunity. Hello, New Zealand. I'm isolating in Los Angeles as we speak. My name's Paul Viskovich. As Skye said, I'm the founder and CEO of Healthfully. We're a healthcare IT company providing a digital health solution. What we're trying to do, and our tagline is a simpler way to better health. I guess when we looked at the market, we saw there was a gap in how people can engage on their health. It's complicated. It's not obvious where you engage and who you engage with and how you engage. And even one health organisation may have 5, 10, 20 different healthcare apps that do one thing, but it's very confusing as a consumer of what's available and how do I engage. So our mission is to remove that friction for people in engaging on the healthcare, make it frictionless and simplify it so patients can get the care they need, the support they want and the inspiration to achieve better health. And we've been on that journey now for the last couple of years, and we've started to make some good momentum over the last year on this journey.
It's amazing hearing some of the stories of your growth over the last few years, Paul, and we'll get more into that. I'm curious if you could actually just step back and tell us how did you end up in the United States, and how long have you been over there at the moment?
Well, in the late 90s, I joined a New Zealand software company called Orion Health, and then I came up to the US in 2002 to start the international business for Orion. We built that to a 100 million revenue company up in the US over the next period, and then it did its IPO and went public. And after that, I left and sort of contemplated things for a while, and then thought there's something else I could do to try to improve healthcare. So we started Healthfully. I moved up here in 2002, which I guess is 18 years ago. So it's actually gone really fast, to be honest. Can't believe it's that long, actually.
How time flies, it's quite incredible.
Yeah.
And I think, Paul, I know we've talked about this in the past and through this work, unbelievably important now, thinking about connecting people remotely, digitally, more than ever at this moment. And maybe you could tell the listeners a bit about how you've seen Healthfully affected by the COVID-19 pandemic work.
So we were deploying. We got a large client where healthcare enterprise, we're deploying in North Florida. We haven't really been able to travel a lot to go to new enterprise customers, but we're certainly doing a lot with our existing customer base and helping them better support their communities during COVID-19. So a couple of examples of that, we had telehealth on our roadmap a bit further down the track. We brought that forward, and on April 1st, we delivered a telehealth solution for our customers. So they've been able to do virtual consults since then. Apologies. Didn't know that was on. Sorry, Skye.
No worries. Sorry.
So the problem in the healthcare was that the clinics didn't want the patients to possibly catch COVID when they came to the office, and the providers also didn't want their staff to get COVID when the patients came to the office. So essentially, all the regular non-emergency procedures and that essentially got cancelled. And it's a for-profit business in the US too. So the other thing that happened is all the governors cancelled elective surgeries around the country as well. So the hospitals needed ways to continue to engage with their patients to keep them healthy, but also to bring in some revenue as well. So we essentially launched our virtual telehealth solution early, and it's been well received. And people are doing virtual visits daily and for their practice, and it's going well. So it certainly helped our customers move that forward.
Oh, that's incredible.
So that's been good. And then with that, we've had other opportunities as well. So because we've got an integrated app that does telehealth and collaboration and messaging and informing and engaging with social communities, as well as that we have remote patient monitoring and health programs. We've also configured a remote patient monitoring solution, so if someone with low acuity has COVID and they're isolating at home, we can track symptoms on a daily basis, track their temperature and the oxygen saturation levels in their blood to make sure they're doing okay at home, and intervene and if it needs to be escalated. And another new program we just launched over the last week is a back to work program for employers. So all employers globally, not just in the US, are scrambling to, well, how do I reopen my business? How do I reopen my business safely? And how do I understand, if my workers are don't have COVID and they're able to come to work and so forth. So we've launched a COVID-19 employer back to work program. We've currently got, on the New Zealand scale of things, it's our first three customer is about 10,000 employees.
Wow.
We've got the local school district in North Florida. We've got the local college. So it's not just going to be the employees before their students can go to their dorm. They have to do the screening program.
Oh, amazing. So do that on an app, and then that will tell them.
Yeah, so it's all on our app. So what will happen in our app, they'll do the initial signing on, and then they'll do the initial screening assessment. And then based on that, if there's some issues with the screening, they'll end up doing a virtual visit with a doctor that may lead to a test. And then we have daily symptom tracking that we have to do on the app every day to make sure that they're still going okay. And that, if they get a clean bill of health, that certificate they can basically take to their employer, say that they're ready to go back to work. So it's a way for employers to know that, they've got a safe environment for their employees and their customers. So at the moment, we're just launching that in North Florida, but we'll look at launching that nationally over the next month as well and see how that goes. So yeah, there's been a lot of diversions for COVID-19, but we're certainly in the right space at the right time if that for this, because digital health is one of the things that can be done, and people are doing a lot of during this pandemic.
Yeah, how incredible to be able to not only have a baseline resource for streamlining all their healthcare, as it was without COVID, and now to be able to add real value at these moments for businesses and patients and so forth is really incredible.
Yeah, we've got some great customers. We're innovating with them. They're providing the healthcare. We're providing the technology platform for them to be successful. And, it's working out to be a good partnership. Everyone's working remotely. Everyone understands that. But, everyone's getting on and making things happen, which is good.
Good old true Kiwi spirit of getting things moving. And Paul, how have you personally been affected? You're based in LA, as we mentioned. How are you coping, and how have things changed for you?
Yeah, we've been locked down in Los Angeles since the 16th of March, I think. So we're into the 6th week, I think. So it's a new normal. To be honest, we're really busy in rolling out these new solutions. So there's nothing else to do but working all the time anyway. So it's been quite fortunate in that regard. And I was essentially commuting transcontinental every week. And now I don't have to do that. That's saving effectively 2 days of travel that I don't have to do. So it's pretty efficient from a work point of view, and we're very fortunate with the type of business we're in that we haven't not just been affected. We're actually hiring more employees at the moment to handle the increased demand during the pandemic. So we're probably one of the few organisations that are actually hiring more staff at the moment.
Mm. Amazing. So there's obviously quite a few opportunities you guys have found as a company and personally in terms of, working in this realm of healthcare and IT. What are some of the specific challenges, Paul, that you guys are facing, beyond the obvious ones?
I guess it's a difficult environment to engage with people at the moment. So the main challenge is around we can definitely support our existing customers well. We have existing relationships, but it's very hard to form new relationships with new customers and build your business during this period. So we were focusing on what we call the enterprise customer, which is a large health system. Like in New Zealand, it'll be like the Auckland District Health Board type size customers, the customers we've been dealing with, which you can't engage with them and remotely and as a new customer during the pandemic. So we're really focusing on what we call a small and medium market. So single clinics and practices that can sign up remotely and start using that. So we've got a number of other clinics that have started to use the virtual telehealth solution over the past few weeks as well, that have essentially just signed up online and started to use it. So we're currently implementing them and supporting them as well, like a foot clinic, pain clinics, other different types of specialty clinics in the US. Mm.
It's, I think it's different in different industries. There's a lot of talk about, getting back to business as usual. And I think a lot of us are also talking about, well, we don't necessarily want to go back in all cases to what we had. There were great things about it, but, and often there are a lot of kind of issues riddled with inequities and problems as well. So kind of thinking about this new normal and what does that look like? And I'm curious for you, Paul, what do you see kind of patient care or health care looking
Yeah,
like?
I mean, I think healthcare particularly is going to change a lot more than, well, probably a lot of things will change, but healthcare certainly. In the US, there was a lot of regulations around providing telehealth services. There was a lot of regulations around who could provide it and to whom. And a lot of it was restricted to rural providers to rural situations where there was no local providers. And it was certainly restricted by licensing. You had to be registered in the state to provide the service and so forth. The government has released all those restrictions at the moment, so essentially you can provide any service that you could do in an in-person consultation remotely. So it's basically opened up telehealth, opened up the telehealth market in the US, and all the healthcare executives that I talk to, and also lobbyists in DC, are basically saying it's here to stay. And those regulations aren't going to go back to where they were. Telehealth is going to be a digital tool that healthcare systems can use to provide care on an ongoing basis, which is great. So, so that's certainly the new normal, if you like, in healthcare. That telehealth will be a major part of that going forward. And digital. If you look at digital in other industries, whether it's banking or gaming or any of the social platforms, there's so much that you could do in healthcare with technology these days. And individuals are used to using technology. They use it for every other type of business they engage with. So why not healthcare? So I think healthcare's time has come, and we're pretty excited in that regard.
Awesome. And what, Paul, last question I've got for you today is around any advice that you might have for Kiwi IT, healthcare or tech companies looking at entering the US market, particularly in the post-COVID-19 world?
Yes, don't. No, seriously. The thing with healthcare in the US is it's a business and it's very regulated. So it's very hard to go from a socialized medicine environment and then understand what drives behavior and buying decisions in the US. And I learned that with Orion, in that you turn up here and it's quite hard to get traction. So it's very important to get some people with local knowledge to help you navigate the new landscape. So you can understand it, and it is very complicated, and even the health systems don't fully understand it at times, so it's complicated. Healthcare is typically profit-driven, and it's heavily regulated, and those things drive the healthcare decisions. So you've got to position your products to solve those business needs if you're going to be successful. And the key thing is, and I ran into that when I was launching Orion up here, is, if you don't have a US reference site, most people aren't interested in talking to you. And then once you've got a US reference site, if you don't want to have one in California, then California's not interested to you. And then when you've got one in California, if you don't want to have in Los Angeles, no one's interested in talking to you. So it gets more local as you keep going through this market.
Yeah.
So the key thing is to find that initial reference site to give you the foothold, even if you give it away, because the reference site is everything in the US. And love that customer to death and exceed their expectations and make them a great reference, and then the rest will take care of itself.
Awesome. Well, thank you so much, Paul, not only for the time today to speak to us and to share your story with Kiwis in the US, but also for the very critical, important work that you and your colleagues are doing at Healthfully. It's really great to know that that's there and really helping folk, get back and define a new normal and keeping themselves healthy along the way. So we really look forward to staying in touch, and please stay safe. And we'll talk to you soon.
Yeah, thank you, Skye. Appreciate that. And, although we're all based in the US, we're a majority-owned Kiwi company by Kiwis, so we are still a Kiwi company.
That's awesome. Awesome. Thanks, Paul, and we'll chat soon.
Okay, thank you. Bye.
Bye.